Hello, my name is Shirley Girouard. I'm one of the co-directors of the Bridge Project here at SUNY Downstate Medical Center, and I'm delighted to be with you today to talk about a very important issue in improving care for older adults in our community and in the practice that we all engage in, caring for folks who are older. This is one of the modules. The Bridge self-learning modules, as you may be aware, consists of 9 different self-learning modules that we're offering for our colleagues and friends in the community here in Brooklyn. What we're hoping to do is improve the quality of care received by older adults in our community. The focus of today's session is on age-friendly healthcare. How do we do that? This presentation is supported by the Health Resources and Services Administration and the United States Department of Health and Human Services as part of an award that was given to SUNY Downstate Medical Center. This presentation is also supported by another HRSA grant and HHS grant that is using non-governmental sources in order to enhance the work that we are doing in the community for older adults. There are no conflicts of interest to declare. These are some of the terms that you've probably seen on other slides and other presentations, but just wanted to be sure that you had those. The ones that are really important to us today are GWEP, which is the Geriatric Workforce Enhancement Program. That program is the HRSA grant that I referred to earlier. Bridge is what we call our initiative here at SUNY Downstate, and that is the Brooklyn Initiative to develop geriatrics education. And that education encompasses all providers, those soon-to-be providers and members of our community. The other thing that's going to be important for us today to talk about are the 4M's, and we're going to go into that in some depth during our discussion today. The 4M's are what matters, medication, mentation, and mobility. And I'll say those words several more times in our presentation. Let me move on now, and let's give some thought to what practice is like today. All of you have been exposed to practice in one way or another, as students, as providers, and I ask you to take a moment to reflect on some of the things that are really important in care of older adults, but also in care of our other patients. But we're going to talk about what makes it a little bit different for our older population. So let's get started thinking about some of the key concepts. Nurse practitioner Walters is meeting a 79-year-old patient for the first time. What is the best way for her to go about conducting her discussion with him? How does she start that discussion? Just take a minute and reflect on that. Think about your own practice. Think about practice that you've observed. When we're engaging in age-friendly care, what we're talking about is knowing something about the patient's personal goals as the most important place to begin. So that's one of the things you need to think about, and the correct answer, of course, is identifying those personal goals with your patient or client. What do you think about this? Physician's assistant Jones is talking about medications with this patient. The most important thing to consider in prescribing medications in older adults is whether or not it works, the effectiveness of the medication. Take a moment and think about that in the context of care of older adults. Is that the most important consideration for you to think about when you're prescribing? Is that the only consideration that you should be thinking about? Just take a moment and reflect on that. It is not most important that the medication is effective. As we know, there are other considerations in medication's effectiveness beyond the medication itself. One of the things we need to think about is what impact that medication will have on the patient's mobility, on their preferences. What do they want? Think about prescribing a diuretic to an older adult and their voiding frequency. How is that going to affect their life? Should we think of other medications that might be better? So when we think about prescribing medications, we really need to think about the impact of those medications on the individual and on the older adult, which may be different than those for younger adults. Now we're talking about Mr. Cohen. This is what he looks like when he's sitting in the waiting room. Social worker Tomas is assuming that he is depressed and is going to refer him to psychiatry. What do you think about this response on Tomas's part? Take a moment and think about what you might do if you confronted a patient like this in the waiting room. No, we probably wouldn't refer the older adult, or any adult perhaps, to psychiatry as our initial reaction to observing this patient. We'd certainly want to find a lot more out about him, about his physical health, about his social health, about his mental health, and about how he's doing today before making reference to psychiatry. In the event that we do think he's depressed, we'd want to also do some screening tools to determine whether or not that depression does exist or whether something else is going on in his life. Here's another example. Dr. Chang, who's a primary care provider, really is the only person who should manage mobility issues in older adults because only physicians can advise about preventive measures and mobility effects of medications. What do you think about this response, that we leave it up to the primary care provider only to do this? Many of us have grown up in the sense that the physician does make all of the decisions about patient care. What do you think about this response for the older adult? The answer, as you probably have devised at this point, is that no, the physician is not the only member of the team that should be engaged in making decisions about mobility or about many of the other things that face our older adult population. The medications certainly need to be considered in terms of their impact on mobility. Here, a pharmacist is also often a very helpful person to do that. The physical therapist certainly would be another person that we would want to engage in this discussion.